So we're looking at the risk factors for epithelial ovarian tumors. So epithelial ovarian tumors, risk factors is more of like you are trying to see things in the life of somebody that will predispose the person to actually having this type of tumors easily, you know. So for the risk factor for epithelial ovarian tumors, you should know that we have different types of ovarian tumors, and we are just singling these ones out. Sorry, I think I should get another color of this pen. We are singling the epithelial ovarian tumors to talk about them, talk about their risk factors. Now, epithelial tumors we said are the most common type of ovarian cancers. That's why anytime they group ovarian cancers like this, they'll still shed more light on epithelial ovarian tumors. Okay, most of the times, because a lot of the percent, you know, about 80 to 90% of ovarian tumors you see in the hospital are the epithelial types. So, and several risk factors have been identified that may increase the likelihood of somebody having these cancers. Do you understand? So, you can have genetic and familial risk factors. So, if there's mutations in the BRCA1 and BRCA2 genes, there's a higher risk. Do you understand? So, they said that BRCA1, there's a risk of about 70%. BRCA2, there's a risk of just 30%. Lynch syndrome, if somebody already has Lynch syndrome, okay, family history. So sometimes there's a family history of all those cancers in the body, all right, just common in women that are from that particular family, you know. So ovarian cancers, breast cancers can be common, colorectal cancers can be common. Do you understand? Of course, if you have any cancer, there's a higher risk of ovarian cancer because that cancer can spread to the ovaries, all right. Then age and hormonal factors. So of course, mostly in people that are about 60 up. Then if you had your menstruation very early, that's to tell you that your body has been exposed to what series of what estrogen secretions more, all right. Or if you have late menopause too, shows you that what your body has been exposed to a lot of estrogen. Okay, menopause, your woman should stop menstruating by 45, start menstruating at 13, 14, 15. All right. Nulliparity, if you have not given birth in your life, there's a high risk for that, because when a woman gets pregnant, there's a pause in what all those, you know, estrogen stop menstruating, so your body rests for a while. Do you understand? So giving birth to children is God's way of trying to protect us against what cancers. Then if you have had hormonal replacement therapy, so you have had all those estrogen, all right, that means your body has been exposed to so much estrogen. I've been talking about so much estrogen because being exposed to so much estrogen is a factor. Okay, so medical and lifestyle factors. If you have had endometriosis, you are obese, if you eat so much fatty foods, if you have been exposed to all those radiation therapy, maybe to manage another thing, you know, but you know that radiation touching your ovaries for a very long time, you know. So other factors is much more common in people that are the Ashkenazi Jewish, okay, that should be like from Israel, okay, occurs so much in that tribe. Then the Peutz-Jeghers syndrome, if you have it too, there's a risk of you having so many cancers in the body, which could also occur in the ovaries. So that's it for the risk factors to developing epithelial ovarian tumors.